We're here to launch the New Orleans Business Alliance Health Innovators Challenge. We're really excited about it. It allows us to partner with Ochsner and other leaders in the community to spur innovation in healthcare.
My name is Jeanette Weiland, and I serve as the Director of Bio, Business Development, and Strategy for the New Orleans Business Alliance. And on behalf of the New Orleans Business Alliance and our partners, Blue Cross Blue Shield of Louisiana and Ochsner Health System, I want to say that we are ecstatic to officially launch the 2019 New Orleans Health Innovators Challenge.
At the City Health Department, we seek to offer New Orleans residents a safe, healthy, and supportive environment where they live, learn, work, and play. And as we expand our definition of health and how we understand the factors that impact health outcomes, such as social and economic factors, the built and natural environment, we also need to seek to engage new partners across sectors and embrace new solutions to longstanding problems. We see this Health Innovators Challenge as an opportunity to do so, to bring brilliant minds from across the country and to employ their skills and knowledge to fix access to care in New Orleans. So thank you again for inviting us to participate, and we look forward to hearing the ideas to come.
This is really about two groups of people. Well, it's really about all of us, but there are really two groups of people. One, our partners, the various entities that are participating, Blue Cross and Blue Shield of Louisiana, Ochsner Health System, Tulane Health System, University Medical Center, and UCMC, the Lafayette General Foundation, and New Orleans Department of Health. These folks have basically said, look, there are challenges, there are opportunities that we would love and are open to working with some of the best talent in the world. And the second group is that talent. You'll be hearing from Lori later on, one of our local successful rock star entrepreneurs in this space. And the reason why this is critically important is because if economic development matters at all, it's because people matter. And we all know that the one thing that you can't overpay or is priceless is your health. And if you can figure out ways to help Big Mama, the friend down the street, to monitor conditions that should be monitored, that are easily treatable through the use of technology, through the uses of innovation, then we have solved one of the biggest challenges facing our city. And that is making sure that this economy works for everyone. And if your health isn't working, it's hard to get anything else going in life. So that's why I'm incredibly excited about this opportunity. The other thing, let me just give you a couple of numbers. I was told by our team that I can't use any sports analogy. So if you know me, I'm a huge sports fanatic, so I'm actually going to stick to a script. So I'm going to ask a couple of questions. Hopefully there'll be some audience participation. What do Amazon, JP Morgan Chase, and Berkshire Hathaway have in common as it relates to healthcare? Anybody know? That's true. They have decided, it's still, I believe, still unnamed, but they're going to disrupt it. But because of what's happening here, we will have a bulwark against that. But the other more important fact, where did they decide to locate their soon-to-be named company? Someone said Boston. It was in Boston. It is Boston. And guess how many medical schools are in Boston proper? Anybody want to guess how many medical schools in Boston proper? Someone said 10 for, the number is 1. Boston proper, not the region, the Boston proper. How many medical schools are in New Orleans proper? 2. If you count Ochsner's partnership with Queensland, there's actually 3 within 15 miles. That shows you the fact that while the rest of the world may not yet know of our ability to compete globally, we know it. And this Health Innovators Challenge will help us get there. Before I take my seat, let me give you sort of the rationale for why this makes so much sense. In 2016, according to the Bureau of Labor Statistics, there were 19 million people nationally employed in this sector. By 2026, that number goes up to 23 million. So that means that there are going to be opportunities for people to realize their dreams and aspirations through employment and eventually through entrepreneurialism. And this sector is $1.13 trillion of gross domestic product. It's 8% of the national's gross domestic product. You are directly influencing and can change and bring some of that product here to New Orleans. And on a per capita spend, Americans spend almost $9,000 per capita on healthcare. We have an urgent problem that affects all of us. And we believe through our tremendous partners here, I would be remiss if I didn't thank our entire team at the Business Alliance and each of you of taking time out of your busy schedules on this rainy day. Together, we are launching New Orleans Bid to not only aggressively diversify our local economy, but more importantly, improve the lives of more of our friends and neighbors. Thanks for participating. I have a lot more talking points. I apologize in advance to my VP of Marketing and Communications, but really, this is about you. So without further ado, I want to invite one of my colleagues, a woman who has been tremendous in really working to not only just bring these partnerships together, but really thinking about how do we continue to provide value to those that invest in the Business Alliance. So give it up for Stephanie Bell, our VP of Investor Relations, New Orleans Business Alliance. Thank you.
This program is in its second year. New Orleans Health Innovators was the vision of our CEO, Quentin Messer, when he and our bio business development team did a deep dive into the needs of digital health entrepreneurs. New Orleans Business Alliance was recently recognized by the International Economic Development Council for this creative approach to business attraction with a Gold Ribbon Award for the New Orleans Health Innovators program. And we know that we would not have been able to pull this off but for the collaborative approach of our partners. So at this time, I'd like to invite Ashley Gardier and Quentin Messer to the stage, as well as Ms. Amy Quirk, CEO of Innovation Ochsner, and Dr. Vindell Washington, Chief Medical Officer of Blue Cross and Blue Shield, to present them with an IEDC Gold Ribbon Award.
We are very honored. And what it means is that the International Economic Development Council is literally the industry association for economic development organizations across the globe. And simply this means that we were on the best single-day events to really satisfy a major objective for all economic development, which is business attraction. Ultimately, we will hope that the companies that participate in this challenge seriously consider relocating or at least opening operations here in New Orleans. Because this is about not only improving people's lives, but improving their economic lives and providing more wealth-creating opportunities locally.
So at this time, we'd like to ask Amy Quirk and Dr. Vindell Washington to stay up here and kick off our first of the NOLAHI challenge statements.
Thanks, everybody. It's such a treat to be here with all of you again in the second year of the NOLA Health Innovators Challenge. On behalf of Innovation Ochsner and Ochsner Health System, it's just wonderful. Thank you to the New Orleans Business Alliance team for organizing this and the City of New Orleans for their vision in supporting the Business Alliance in these initiatives. I'm really happy to be here with our partner Blue Cross and Blue Shield of Louisiana. Our partnership with Blue Cross is based on a shared vision to improve the health of everyone in Louisiana. And NOLAHI provides us with an opportunity to provide a targeted, needs-based approach, to put a call out to the entrepreneurial community to ask them to help us to achieve that vision. At Ochsner, we're relentless about changing and saving lives through innovation, collaboration, and inspiration. Throughout our more than 75-year history, we've served patients throughout New Orleans and Louisiana, and now we're proud to say that our reach has expanded nationally and globally. I'm also proud of our work to push the boundaries of healthcare as we know it, and to establish Ochsner and this community as a pioneer and a leader in healthcare innovation. Today, at a defining moment when there's so much need and yet so much opportunity to reimagine the experience and delivery of healthcare and to improve health outcomes, Innovation Ochsner, or as IO as we like to call it, is working every day to solve some of the most pressing healthcare challenges we face and create new value with new thinking. We know that integrating technology and leveraging data can help us create patient-centered solutions that will make the delivery of healthcare more preventative, the experience better, and lower costs. So IO has designed new digital health tools that help us address the epidemic of chronic disease, high blood pressure, diabetes, COPD, that affects our families, our friends, and our neighbors every day. Ochsner Digital Medicine enables remote monitoring of patients with hypertension and diabetes via digital tools and connected devices, allowing us to offer proactive and holistic care that is more convenient and effective. This virtual care model works, and it keeps people living their best lives. That's what we're all about, and this is just one way that Ochsner is innovating to improve the health of the community we serve. Now, we know that there are many factors that impact an individual's health. In addition to clinical data points that healthcare traditionally looks at, our health is impacted by a much broader set of determinants. Obviously, your activity and fitness levels, your diet, but also things like socioeconomic status, health literacy, transportation, and even whether you're living alone. To have the greatest opportunity to improve health outcomes, healthcare solutions must account for all of these factors so that we can understand the entire story of each individual we serve. With that background, I'd like to introduce Dr. Vindell Washington, Chief Medical Officer of Blue Cross, who will reveal our challenge statement to the entrepreneurial community and innovators everywhere to help us bring their ideas, their creativity, and their talent to help us solve this problem. Thank you.
Well, thanks, Amy, for that intro and to get us started. I am Vindell Washington, the Chief Medical Officer at Blue Cross Blue Shield of Louisiana. I, too, as Quentin had mentioned earlier, have been unleashed by my marketing communications team to sort of go a little bit off script, so I'm going to take advantage of that. I'm going to first start by saying it is quite a privilege to partner with Ochsner again in this effort. We're really proud. We think that this Innovators Challenge is something that's important for us from a corporate perspective. Last year was quite encouraging. So in our first year, we were able to find and award the company Altergy, which had done work with the needleless blood glucose monitoring system, and then some of the funding that we provided was put with other funding to help them miniaturize that device and really help to improve the lives of those folks with diabetes as it moves forward and hopefully comes to an even larger market in the future. But it's that kind of innovation, I think, that inspired us to continue along this path, to push us toward year 2, and we're excited about it. Our mission at Blue Cross is pretty simple. It's to improve the health and lives of Louisianians. And it's not just the 1.8 million folks that are Blue Cross Blue Shield card carriers. It's really the community as a whole, and we take that as a serious corporate mission. We are the state's oldest and largest insurer. We've been around for about 85 years or so. The company really had its roots in the state. We feel connected to the state, and that's one of the reasons that we're so passionate about this kind of community activity that lifts the community more broadly, and we think that part of that is through partnerships like the one with New Orleans Business Alliance. As Amy had stated, really, if you think about health generally, it's really not just the care that you receive. In fact, there have been a lot of studies that look at really what the drivers of health in its largest and broadest sense are. And most of those land on some number like 10 or 12% of an individual's health is determined by the care that they receive at a moment of crisis. A lot of what determines a person's health is really more around the elements around them. Yes, genetics play a role, but we're really talking about maybe as much as 40% of a person's health is determined around the environment they live in, whether they have access to clean food, clean water, good food, those kinds of things, transportation, literacy, education. Those are all critically important to an overall health of an individual, the health of their family. And so we are leaning in on that as a challenge. If we think that we're going to get solutions for members, we think that we have to look at them in a holistic way, and that's why we're partnering with Ochsner in this. We're also doing advanced analytics on data. We're trying to include that social determinants data in that work, and so our Senior Vice President for Data Analytics, SOMESH, NIGAM, and others are working on developing tools that help us target individuals with precise solutions that help them improve their health and lives. It's a critical component to look at things other than the actual care delivery. I did want to go off script a bit and give you an anecdote about this, and I'm particularly passionate about it. We had an effort not many years ago when I was working on the health system side of things, aimed at trying to help, in particular, congestive heart patients. We wanted to make sure that they did not return to the hospital after an admission. We wanted them to have healthy lives after this critical point in their life. And so we were looking at factors that would help us predict and determine which individuals would end up back in the hospital or have a catastrophic outcome. So as a clinician, I'm an emergency medicine physician by background. I consider myself a little bit of a scientist at least. I mean, I thought it would be the usual suspects. I thought it would be something around their blood counts or a troponin level that signified how well their heart was working, or perhaps an ejection fraction that would show how much blood was being pushed with each stroke of their heart. That would be a key indicator of whether or not a person would end up with a bad outcome or end up back in the hospital. To my surprise, one of the key indicators, in fact, the most important indicator of whether or not a patient was going to return in a short period of time after discharge, was whether or not on the admissions intake form they had identified a caregiver or someone with them. So if you came to the hospital alone and left alone versus coming with a family support system, you were much more likely to end up back in the hospital with a complication. The reason I share this story is not that we have the grandest idea of solving every social determinant problem, but it's to underscore that it's not just the science of medicine that's important. We're whole human beings when it comes to our health and living healthy lives. And this challenge, the way we've framed it, is really to focus on what happens between those visits, what kind of social systems exist. We have a lot of data as an insurance company. Ochsner has a lot of data as a care deliverer. What we're asking in this challenge, though, is for us to develop digital solutions that will allow us to pool those data sets and then use other elements of the social determinants of an individual to craft specific solutions that will work for that individual member. Those could really be solutions around identifying gaps in the existing care delivery, identifying social needs that are not present for that individual, so that us as a collective group of caregiver and payer can figure out solutions for those individuals. We think that that's a worthy cause for us to lean in. We think that having a digital solution that's really available to us both as provider and payer will help us really target our solutions to those that are most at risk and have us to have great outcomes for those individuals. So we're really calling at this point for the entrepreneurs in the community, the entrepreneurs across the state, and as broad as our reach can be, to help us come up with solutions that look at these social determinants, help combine that data with our data to come up with community-wide solutions for these social determinants. We're excited about it. We're looking forward to the solutions that come, and at this point I'd like to turn this back over to the New Orleans Business Alliance to let you hear more about the other challenges proposed this year. Thank you very much.
I believe we're all here because above all else, we are committed to the care and improvement of human life. Part of our challenge here is going to address that. Healthcare costs continue to rise, and more of that burden gets shifted to the individual. How can they take ownership of their own care? Having the higher healthcare costs can often lead consumers to delay that needed care, and we want to be able to prevent that. As a premier academic medical center, Tulane's mission is to provide world-class patient care, education, and research. As such, our innovation challenge really is inherent in our mission. We are seeking solutions that to help patients lower their own cost of care, and specifically, we're looking for innovations that can help consumers reduce their out-of-pocket cost of healthcare, ensuring that financial issues are not delaying the needed and preventative care. Can the individual and innovation tailored to the need of the existing patient based on their individual healthcare plan. We're looking for something a little bit more comprehensive than maybe just an app, because we all have apps on our phone. Do they get used? I don't know. You guys tell us. We want you to be creative in this challenge. Many healthcare innovations reduce costs indirectly. For example, population health. They get out the education, they provide some preventative medicine for us, and reduces the need for healthcare services. For this challenge specifically, preference will be given to innovations that are specifically geared towards innovations likely to have the most significant impact on the current hospital patient population. We look forward to partnering with creative thinkers to develop fresh solutions to ensure a healthy future for all patients. Thank you.
One of the questions comes into your mind of why is a health system from up the bayou standing up here and participating in this challenge when it seems to be very New Orleans centric? And the answer is because of our partners, right? So first and foremost, we're part of the Ochsner Health Network, right? We're one of the founding partners there. And our partner, Blue Cross and Blue Shield, again, without having them, we couldn't exist as a health system, right? And so as the executive director of the Innovation Research and Real Estate Investment function with Lafayette General Health, we quickly realized that as a small market billion-dollar health system, we couldn't figure out everything we needed to do in order to serve our patients. I mean, our mission is to restore, maintain, and improve health, right, for all Acadians. And it quickly became evident that we needed to take an outside-in approach. We needed to find really smart people out in the marketplace that were creating solutions for the problems that we had. And so with that, and approval from our board of directors, we formed 2 venture funds, Healthcare Innovation Fund 1, creative, right, and Health Innovation Fund 2. Health Innovation Fund 1, a $3 million microfund invested in 5 companies, 4 of which are from Louisiana. And if any of you are paying attention to the digital healthcare marketplace right now, you'll have heard of a company called HealthLoop, and HealthLoop was just recently acquired by the GetWell Network. And HealthLoop was one of our investments. And so we're very proud that our model worked, that we brought them in and we were able to have them participate in our ecosystem. So we bring them in and we invest in them, and then we open up our sandbox to them, right? And so we're now in the process of finalizing the capitalization of Health Innovation Fund 2. And what's important about that is this, and sort of ties back to everything. Last year when we participated in this challenge, we had the Data Interoperability Challenge, and we had 7 companies from around the nation respond to that challenge. And a company named Simply Vital Health, a blockchain-enabled company, won that challenge. And Quentin, you're right, because they're based in Boston, and we're going to bring them down here once we make that investment, if they make it through our process for a Series A, right? So, and that's part of the investment requirement, that they open up an office here in Lafayette, Louisiana. Just kidding. So the rock, paper, scissors game is we don't care where they locate in Louisiana as long as they come here. And so with that, you're going to hear a bit of a thematic. And if you don't mind, I'm going to sort of go to my device so I can read you our statement for this year. And again, it's much along the lines of data, all right? So healthcare must continue its transition from patient engagement to patient experience, specifically focusing on the delivery of healthcare information to the patient in near real time. No longer should a patient wait to get their records, have to sign into multiple systems to retrieve information, or have to wait days for the results of tests. Patient-centered healthcare outcomes and the incorporation of Internet of Things, or IoT devices, in the health record are a must. We are looking to hear from companies that are seeking to solve these problems, specifically the unification of multiple disparate data streams in near real time and delivered to the healthcare patient consumer in the modality and on the device that they choose. We look forward to continuing our partnership with NOLAHI. We're very thankful for being invited down here with Blue Cross Blue Shield, with Ochsner and Amy, and our other partners. So thank you very much.
So good morning, and thank you to the New Orleans Business Alliance. I'm very proud to represent not just myself, pardon, but also Dr. Avegno. These are exciting times. I want to really pay homage to the legacy of healthcare that has occurred in the city through Charity Hospital onto the interim Louisiana Hospital, and now to the University Medical Center, with a proud history of delivering care to all patients. That's a rich legacy, and we're going to continue that legacy. I'm proud to represent UMC in that endeavor. Dr. Avegno trained within that system as well and continues to work in that system, but is now working for our city. So as a challenge statement, UMC is seeking a vibrant partnership. We want one that utilizes bright minds and innovation to address critical healthcare access. Access for who? Specifically targeting a population for our New Orleans service workers, the people in the hotel industry, people in the restaurant industry, people in the music industry, who struggle with connecting with simple primary care within our community. We feel that if we develop innovation in connectivity to that group, to our hospital, we're going to improve the overall health of the city and create a model of health care for the future. Thank you.
Okay, and finally, now we are going to hear from our keynote speaker, Dr. Lowry Curley. He is the CEO of Axosim, a nerve-on-a-chip bio-startup company that is currently incubating at the beautiful New Orleans Bioinnovation Center in the heart of our biomedical district. Moderating that talk with him is our own Business Alliance's Vice President of Industry Attraction and Retention, Mr. Louis David.
We can grow living human nerves in our lab that look and act like a nerve would in any of your bodies. This allows us to work with pharmaceutical companies as an alternative to animal testing. So we help them develop better drugs. We are working with some big pharmaceutical partners to help address ALS and multiple sclerosis. And again, what we do is allow them to choose the drug that has the best chance to work in patients before they ever even go into clinical trials or test this in a human.
So how long have you guys been around, and how many employees do you have?
So we founded the company in 2014, spun out of Tulane University, myself, and actually my old PhD advisor, Dr. Michael Moore, which it's been kind of fun, switching the relationship up a little bit. So we are now just hired our 10th employee, so growing pretty quickly.
It's awesome, congrats. I think the big question, and I hope I know the answer to this question, but the big question about NOLAHI and to you, can your company grow and scale in New Orleans?
That is the million-dollar question, for sure. I mean, so far I think we've done a fantastic job of it. Now that we've sort of hit this inflection point of moving past 10 employees, the challenge has become a little bit different. I would say, the access to capital is one that inevitably comes up in New Orleans. I personally think that this is getting better here. I just got back from Boston last night. Sounds like there might be a Boston company being recruited to Louisiana, which is awesome. But a lot of people have this notion of Silicon Valley. You roll out of bed and you got $10 million sitting there waiting on you with, an idea that's half-baked. I mean, I think in biotech that's not the case, and been having a lot of conversations in Boston where you have to fight for money there too, because yeah, there's more of it, but there's also a lot more noise in the sense that there's a lot of companies coming out with interesting technology, but how do they differentiate themselves? And so, the other aspect of that is what we can do down here with, let's say, $300,000, it might take you $500,000 plus to do that in Boston. So, there are opportunities there. I think there, will be challenges, and we're kind of facing this right now. Once you need, let's say $2 million, $3 million, it sort of changes. And I just want to say what Cian's doing, with Lafayette General is pretty amazing. Having kind of that built-in investment arm, at the same time of what the purpose of this is to allow innovators to succeed, to point them in the right direction and then support them on the back end is pretty amazing. So I think on the capital side, again, that's an ongoing conversation. Biggest one that we see coming up is workforce development. So we've gotten to 10 employees, which is awesome. It still feels like we're just getting started. But What we've been able to do, and I wouldn't necessarily thought this would be the case, we've had a really good, done a good job at recruiting kind of master's, PhD level people. We've gotten people coming over from Northwestern, people from the West Coast, which is phenomenal, and that's what we've needed. But now we're getting to a point where we're not just developing this nerve on a chip, we are applying it. We're working with pharmaceutical companies. So the question is now, how do we get access to talent who's from New Orleans, who wants to stay to New Orleans, as opposed to really bright folks we get that we know are going to kind of graduate and move on, go to med school, go to get their doctorate. And so I don't think that there's an answer yet. But we, are looking forward to trying to forge some new relationships. The bio district is kind of reemerging. Delgado's got some programs. I think it's just going to take the whole community to tell people, what do they need to help these workforce development develop the right workforce.
So I think we all know, especially in South Louisiana, that New Orleans has been a hub of medical innovation basically since we were founded 300 years ago. Just because there are a lot of back then there were a lot of challenges to living in a swamp so far away. But what do people say when you're at a conference, you're in Boston, and you say, "Yeah, this is my awesome idea." "Oh, where are you located?" "Well, we're from and we're growing this company in New Orleans." What do people say, and what do you say to combat their answer?
Yeah, that definitely comes up, as you can imagine. When we say we're in New Orleans, the first thing is, "Oh, really? In New Orleans?" And the best way to break the ice there is to invite them down to eat and go out and hear some music. That usually is a pretty good sales tactic. But it really helps to show them we're located at the New Orleans Bioinnovation Center. When we tell people where we are and kind of are able to show them what our facilities look like, they're shocked. And so there's more here that people aren't aware of. But the good thing is the pharmaceutical companies we're working with don't really care. In a sense, the world's getting smaller. And as long as we show them we're not a mom and pop situation, they're willing to work with us. So that's less of an impediment than I think it ever has been in the past.
Are people ever surprised about the kind of talent and the kind of resources we have here?
I mean, again, when you start talking about the number of hospitals we have, the universities that we have here, it's relatively easy to make the argument that there is access to that sort of top-tier talent. I think something that people don't think about, and I'll kind of just go back to the workforce development, is how do we, get that middle-tier skills, the middle-tier workforce that people don't think about, but is really just as critical as access to the top talent.
So I want to ask you, as we have all of these healthcare providers in the audience, and what can they do on their side to make it easier to do business with a startup and to say, hey, we want to pilot this technology and we want to kind of look outside the usual suspects of vendors to see where we can grow and where we can be pioneers?
Yeah, I've got a couple ideas as an entrepreneur. Anything that anyone can do to make our lives easier is a huge help. So, first, the fact that this is even going on obviously means there's people who want to listen and who recognize that this is important. Dr. Washington was talking earlier about the determinant factor of people coming and leaving from the hospital alone. I think sometimes it really takes thinking outside of the box. If you are in the middle of something, it's hard to kind of pick your head up and look around and see alternatives. And so the fact that you're giving structure to a search for the startup companies and giving them room to operate is really, really good. So, announcing these challenges lets, first of all, them know what your needs are. And for entrepreneurs, a lot of times, we've had this cool technology, we don't necessarily know where to apply it. So this breaks down that barrier right away. Now, what I would say moving forward from here is that it's important for these companies to know what your process really is moving past that. So let's say they develop the most amazing thing in the world to solve any of these challenges. What is realistically the timeline it's going to take for any of this to get integrated, for them to get $1 out of this from your organization? I think entrepreneurs are inherently optimistic, or else we wouldn't be crazy enough to do what we're doing. And so just be transparent with that is really what I would say. If it's going to take a year and a half, say it. Tell them, tell us. If it looks like this isn't going to work out, the sooner you tell entrepreneurs, the better. So, like I mentioned, anything you can do to make our lives easier. We always think things are going to happen faster than they are. We always think things are going to be cheaper to implement than they ever are. So, getting a peek inside your gigantic organizations that are night and day different than what we're doing goes a long way.
So, other than NOLAHI, what are some ways that the bigger companies, the healthcare anchors in the Gulf South, can be more engaged with the startup community here?
Well, this is certainly a great start, and I guess I'll again kind of point to what CN's doing at Lafayette General. First we need to know what the need is. Is there a market there? And then, we need support to do that. So if there are ways, even if it's not through a challenge like this, something like Innovation Ochsner, where you can kind of open up a little piece of what you're doing to entrepreneurs, I think that that's really important. We've got some incredible talent here. We've got some incredible companies coming out, but inevitably in the life of, I think, almost any startup, there comes a time when you have to pivot. So these companies might be coming out with an idea and, they think they understand the market that they're going into, and it turns out they might not. So the faster that they sort of fail and the faster they're forced to pivot, the better chance they have to succeed. And the only way to do that is visibility.
And it sounds like honesty, too, on both sides.
Yeah, no, 1,000%.
Yeah.
We're working with pharmaceutical companies directly, and a lot of times we'll talk to people like, this is really cool. Like, let me go back to my manager. I think we have a project for you, and then they fall off the radar. If you know that there's not the budget or you're not really interested, just say it. As entrepreneurs, you have to have thick skin, and so that's fine. Yes, honesty is helpful.
Yeah, we've actually seen that with one of the NOLAHI winners from last year. They decided to pivot to a different idea, the management team, but they were already exposed to New Orleans, and they said, well, New Orleans may be a good place to try our second idea as well. What would you say to people who are outside of the market who are saying, why would I apply to a challenge in New Orleans? What would that open me up to? What would you say to encourage them to, take a look and see if this is a good fit?
One of the biggest things is really cost of living and cost of doing business. You're talking about coming down from Boston. We've talked to a lot of startup companies there. That some of them are paying 5 to 10 times what we are just to have facilities. That's, some of that's on the upper end, but nobody's getting the cost to set up shop down here that you're able to get. And you're able to, frankly, pay people a little bit less here, and that's because the money goes farther. So that's one of the first things. And I think New Orleans is also a relatively easy sell on the fact that there's a lot of energy here, it's emerging. Obviously, Katrina was a long time ago, but it brought sort of this buzz to New Orleans that we've never had before. So, I think when you bring companies down here, you show them the resources that we have that they might not know. And there's a lot of intangibles New Orleans has that nowhere else really does.
And what are, where do you see Accessim in 5 years?
That is a great question. Really where we want to go is expand. We're at 10 people right now. We plan to hire 4 people in the first quarter of next year. But, we want bigger vision than simply growing in New Orleans, which we're going to do, but we want to expand our reach sort of internationally. And so what we ultimately want to get to is not only partnering with these pharmaceutical companies to help them develop their drugs, we really want to show them that we have the most advanced technology that's out there to cure neurodegenerative diseases and to get them to give us a piece of the pie. So in a sense, New Orleans has had difficulty developing drugs here. So there's not necessarily enough capital. Clinical trials are difficult. If we can show them that we have technology that can unlock this, then they just start looking more and more to New Orleans. And, at that point, I think there's ability to, frankly, have kind of a big exit here, bring some big money in. And then what I absolutely want to do is be able to support the next generation of entrepreneurs. So, once Accessim is successful, help build the next wave, essentially.
Yeah, that's right. Sell it for a lot of money and invest in lots of other different companies.
Yeah, and I think you said 5 years. It'll probably happen in like 2 years.
Okay.
So, yeah.
All right, that works.
That's that optimism that I mentioned.
So Axosim is a great example of a company that's here in New Orleans already. Obviously with the New Orleans Health Innovators, we're trying to attract companies to New Orleans with the help of our healthcare partners. Tell us a little bit about what folks can learn. I want to plug Innovation Louisiana, which is hosted by the New Orleans Bioinnovation Center, which is next week. And that really puts a spotlight on the companies that are here that are, this is not an either or conversation. This is a we need both. So how can people engage next week at Innovation Louisiana?
I think what's exciting about Innovation Louisiana, it brings together people who might not otherwise be here. So again, kind of opens lifts the lid on New Orleans, lets people see what's here. But for people who are stakeholders, what's I think interesting, it's almost the flip side of this. So here are these big institutions saying these are the challenges that we need to solve, whereas what NOBIC is doing is incubating companies that are already there. So they have their BioFund challenge, and that'll be companies that have an idea pitching to everyone here. So, if you may have connections for them, and it gives exposure to the entrepreneurs in a way that haven't been able to do, brings together investors, pharmaceutical companies. So really good opportunities to network there, and some really cool technologies you might not know about otherwise.
And in what we were talking specifically, what kind of people do you need?
So we need laboratory technicians, essentially. I sort of mentioned we've been good at getting these master's, PhD level students who help us develop these ideas, but now we need people to execute. And I think a misconception about workforce development in biotech is that there's this huge hurdle, this huge barrier to entry, that it takes 4+ years to develop this talent, and that's simply not true. Delgado has an associate's program that's going to give us exactly what we need. The people are in place in New Orleans who can fulfill the roles that we need, and we want to help sort of lift New Orleans up in a sense at the same time that we are getting lifted up. And so, supporting stuff like Delgado, I kind of mentioned before, it's going to take the communities here coming together and helping define what workforce development really is. So here's the skill set we need. That seems easier to do with more pure tech companies. Yeah, you need coding, but it's really not as difficult in biotech as people think. So I want to make sure that conversation's happening more and more.
That's one good thing that I have not brought up today, but one of the reasons why we're looking for digital solutions for some of these challenges is the state has very generous software incentives. You get 25% back of your labor spend in Louisiana. That's really drawn our technology sector over the past few years with GE and DXC, as well as a number of homegrown firms, Lucid, iSeats. But how can that collaboration, as we're fast becoming a tech city, we've always been a medical research city, how can we pull those two together in the next couple years?
That's a good question, because absolutely the tech community is leading the charge here, and I think biotech is quick on their heels. Where I think there can be a lot of communication is how are they developing these programs that they need? They're two different industries, but the same, I think, structure can be in place. Is how do you find people who are interested in high school? How do you make sure that they know where their opportunities are for themselves to develop into what we need? We hosted 2 Youth Force NOLA individuals this last summer, and what was frankly amazing and kind of got me a little bit emotional at the end of it is we interviewed them and said, what did you like about this? What did you not? And they basically said, we had no idea that there was even biotech around, that it even meant this. When they thought about anything bio, they thought nurse, they thought doctor. And, not everybody's gonna be able to do that, but they found what we were doing cool, and I think now they understood that there's a path that they can enter that workforce.
Challenges like this are critical to developing our ecosystem. There's a lot of innovation, and we really need to spur that. It's not inherent like a Boston. I think where the real value is as an entrepreneur, sometimes we build tools and we have incredible technologies. We don't know where to focus them, and this really makes sure we're developing a product that has a market.
What are the challenges, such as NOLAHI, which bring entrepreneurs and community members together to solve some of the region's biggest healthcare challenges? Why are they important for the future of healthcare?
Well, it's important, like I said, you are developing a product for a market. And when you're developing it for some of these huge hospitals, these insurers, you know that there's a built-in adoption and there's exposure you can get in a way you simply wouldn't be able to otherwise.
For companies and entrepreneurs thinking about participating in the challenge, why would you encourage them to apply?
I think a lot of these questions are related. It's exposure. There's money involved, and you're going to get advice and help from people who really know this market better than you possibly could.
The innovation is a key factor in changing how we can deliver care. So without new ideas and new technologies, it's hard to really make the great advances that we expect in our society from it. So the challenge today is to provide some funding and some framework for folks to bring those innovations to life.
Why did Blue Cross and Ochsner choose to focus their joint challenge statement on finding a digital solution that would allow healthcare providers and payers to gather social determinant data, to identify gaps in existing data, and to structure that data to effectively effect individual level risk assessments?
Well, one of the things that we've found to be true is that a lot of a person's health status is not determined only by the care that they receive in the delivery system itself. In fact, about 80% of a person's health status is due to these other social determinants, and these are things like a person's education status, whether they have access to good foods, whether they're socially at risk for violence in their community, whether there's pollution. And so a joint challenge like this allows us to collectively get information, take that information, and make it actionable through analyses.
Nationally, Louisiana is ranked low for health care costs and quality. How could the digital solutions we get out of this challenge affect those trends?
Well, really what we're trying to do in addressing cost and efficiency is to bring new thoughts and ideas to the table for caring for patients and members. If we're successful in the challenge, that will help spur us along, help decrease the cost, increase the value of care that our members receive.
Blue Cross clearly is the largest payer in the state of Louisiana, and it's our mission to improve the health and well-being of all Louisianans. And we are the first ones to recognize that not all innovation happens within our four walls, nor does it happen within Ochsner's four walls, which is, of course, who are the largest healthcare system in the state. So it's really in the interest of payers and providers and the entire ecosystem to invite folks and to help. And great ideas could emerge from anywhere. They can be from a university, an entrepreneur who's trying to start a company, someone who has a great idea, within our four walls and they want to participate in it. But it is, our members struggling with disease often innovate. A lot of diabetes-related innovation actually has happened because diabetics have taken charge of their own disease. So we do want to combine it and bring it in and help nurture it and grow it.
Our state, like every other in the country, is facing a number of healthcare challenges, chronic disease being one of them. And so we've got to call out to the community, the broader entrepreneurial community, to say, help us solve our problems and leverage a lot of the work that we're doing with our partners like Blue Cross to bring in innovation and to solve some of the challenges that we're facing, so that we can improve health for our whole community, for our state, and for the region.
Social determinants, these are things that are really not the medical factors, but they are things, for example, they talk about person's economic situation, where they live, what are their behaviors, what type of social supports they have available, family, community, etc. What is the level of crime in a particular area where they live? Do they have access to good food, transportation? Can they drive, or they need to be provided with some help if they have to go visit the doctor? All of these things, do they live alone or not, right? So all of these things are really not in a medical record often. And combined, they are called social determinants. A lot of studies have shown that half to three-quarters of our health is really determined by social determinants. So you can imagine if someone is struggling with diabetes or hypertension, if they can improve and start walking around and take certain preventive actions, eat better food, exercise, it certainly will help the disease. Well, if they don't have walking paths in their community, that's going to be a problem, right? So I do feel, or it's not a safe community. So we realized very quickly that in addition to knowing someone's claim history or medical history, medical record data that may be in a clinician's office, we need to know their social determinants as well. And combined, we will be able to predict what their outcome is likely to be and how to intervene appropriately.
We believe that there's a lot of great thinking out there and new ideas that we can bring to create new value for our patients, for our community, and to show the nation how healthcare innovation works. And so crowdsourced challenges like NOLAHI, where we can design a challenge statement and put out a need to the community and say, help us solve this issue. Let's work together to solve a specific issue, has the potential to create a lot of change, positive change for the community. And so we're hopeful that we'll be able to find someone out there with a great idea about how we can leverage social determinants data and use that and integrate that into our care models, which we're already doing a lot of work at Ochsner with digital health care models, to use digital tools to make care more convenient, more proactive, and ultimately more effective.
The main issue here is that no one has all of the data about the member. We have claims which tend to, of course, record the financial aspects and the type of service that was provided, whether it was a doctor's office visit or it was a hospital stay or what have you. And then doctors have rich clinical data, for example, right? They have their notes, what was the suspected diagnosis, what was done, what procedures were done, details of the clinical situation, really. When you combine, and of course, we just talked about social determinant. None of us have that. We need to get those. So by the time you get it all, you create what we call a member 360-degree view. So we are looking at that member from different angles. And that combined data with advanced analytic techniques such as the ones that artificial intelligence brings to us allows us to really pinpoint who needs help today. Who's vulnerable, who needs to be called, who needs to be outreach, who needs a visit. And the whole idea is, can we change the trajectory of disease progression and adverse events and be able to get them to a better healthy state?
What we know is that in healthcare, traditionally, we've traditionally looked at just one slice of the whole pie that contributes to someone's health. So we might look at clinical data points, which are very important, obviously, but a person's health is determined by many more things. Obviously, your diet, your fitness, your activity levels are really important. But it goes to other things, transportation, socioeconomic status, health literacy, even whether you live alone or not. We need to understand a person, each person's conditions and the circumstances that lead to their health, and be able to leverage that data so that we can provide patient-centered solutions that are effective in helping drive health outcomes in this state and elsewhere.
These challenges are incredibly important for really three principal reasons. First, economic development only matters to the extent that people matter. And these challenges allow for us to find solutions to help people with their health challenges. And that's the one thing you can't give back to people, health. And in this environment, we really need to be very sensitive to that. And these challenges allow us to bring those solutions. And second, it allows us to bring the best in technology from across the world here to New Orleans. And finally, allows us to really leverage the assets we have here. We've got one of the most innovative payers in the nation, Blue Cross and Blue Shield of Louisiana. We've got one of the most innovative healthcare systems, Ochsner Healthcare. We've got the city of New Orleans involved. And so we really think it's an optimum time to improve not only quality of life for our residents, but also make sure that we have great opportunities in the future.
Tell us, why is it so important for the Business Alliance to help build relationships and business opportunities between established healthcare companies and entrepreneurs?
Well, there are really three reasons again. The first is when you talk to most companies, beyond capital, most companies say they need clients. And this is an opportunity for us to put clients, Blue Cross and Blue Shield, Ochsner Healthcare, City of New Orleans, in front of entrepreneurs, which makes it more likely for them to consider relocating to New Orleans. The second thing is, again, this is about people. All economic development comes to people. So to the extent that we can help more of our friends and neighbors monitor their chronic conditions and have greater opportunities for improved health care, that's tremendously important. And then the last thing is, we really want to take advantage of the opportunity to become an innovator in healthcare. We had a great speech last week by Bruce Katz, and he talked about the fact that we've got some tremendous assets here. And we feel at the Business Alliance we have an important role to be conveners and bring those assets to bear together.
It's clear in today's environment, in the market that participate in, that innovation is in fact where we need to look for the solutions that are going to bring us success in the future. NOLAHI is the catalyst and is striving very much to improve and bring innovation to the city of New Orleans, and it's just clear that we need to partner with them in that effort.
Why are collaborations between healthcare payers, providers, and entrepreneurs so important for improving healthcare?
Just like other markets where we see Amazon competing and Google competing, innovation and meeting the customer's needs is coming from the entrepreneurs. They have the closer perspective as to what the needs of our population might be. And so healthcare is not distant from that. We need to have innovation, and partnering with entrepreneurs through such events as NOLAHI is going to afford us the opportunity to benefit from that.
And why is it important for Blue Cross not only to be part of innovation in healthcare, but also be a leader and a driving force in it?
So oftentimes customers come to an insurance company and look for the solutions that they need for their health care, whether that's innovation, it's navigation, and the choices of the providers that they seek. Therefore, customers looking to us for those solutions, it is just critical that we provide opportunity for innovation and collaboration with providers so they ultimately receive the care and the services that they're purchasing.
Participating in the challenge allows companies to be in front of clients, whether it's a payer or whether it's a healthcare system. And when companies really want to be validated for institutional capital, they really need to prove that they have a marketly viable product or service to sell. This allows them to do that. And then the second thing I would say, what do you have to lose? You have a great opportunity to compete, to come down to New Orleans, experience the hospitality, and also really have feedback with some of the senior executives in healthcare, not only in the state, the region, but nationally.
I'm excited. You know, there's a lot of energy, a lot of buzz, and a lot of buy-in from some of the big players around here. So it's great to see everybody working together.
It's so wonderful to see the community, our partner Blue Cross and Ochsner coming together, one, to say let's work together to solve some of the pressing challenges in our state and drive healthcare innovation in our state so that we can have the healthiest state. So that's exciting. The great energy in the room of all of the entrepreneurial ecosystem that's very vibrant in this city and in this region that's here today is wonderful and united around a common cause of driving healthcare innovation. At Ochsner, that's part of our mission. That's what we do every day inside of Innovation Ochsner, so it's a wonderful opportunity to be a part of that energy here today.
I'm incredibly excited. I tell you, healthcare is one of the largest sectors in the American economy. New Orleans is uniquely positioned. We're one of only 17 U.S. cities with 2 medical schools. We have tremendous assets here, and this allows us to bring those assets to bear to improve the quality of lives of our friends and neighbors. And so you can't get more win-win than that.
Continue to be thrilled with the opportunity to partner in this event. We've seen last year how the competition brought forward some really unique ideas. We were pleased with the winner of Alerchi. This event today is just a continuation of the excitement and the opportunities that a lot of us don't know that are out there because we need to connect with those entrepreneurs and those people who are testing the boundary on innovation. And so we're just excited to come forward and be a part of that.
If people have questions like more information, what should they do?
They should come to our website, bcbsla.com.